Hello, my name is Eddie Sheets, and this is my patient Jacoby. We're going to do a head, eyes, ears, nose, and throat, a Heent assessment. So, I work in surgical services, a sterile environment. I couldn't really do this at work or at a setup, so we're having to do it at home. The first thing I would do is gather equipment, make sure I've got the proper equipment for the assessment. I have got the otoscope, I've got a tongue depressor, and I've also got some gloves. Once we get into the room, we want to provide privacy, wash our hands, and then at our patient, as a nurse, we do a general observation over everything: the appearance of the patient, obvious physical deformities, personal hygiene, clothing, make sure it's appropriate for the season, note their skin, their effect, their mood, speech, hearing, nutritional status, that type of stuff. So we do a general overall appearance. Then we start with the head and face. First thing we're going to do is we're going to observe and make sure we've got eye contact. We introduce ourselves to the patient. They tell us their name and their birth date for their identifiers. We check their orientation. We want to inspect, then palpate. So I'm going to look at the patient's head, make sure we've got symmetry, check the hair, make sure the texture. Then we're going to palpate, make sure there's no indentions, no lumps, go all the way back to the occiput, and then we come back to this area. So once you do that, you want to check the face, you want to check symmetry, you want to check the temporal artery, and then you want to go down to the temporomandibular joint. Can be open and close your mouth. Check for popping. Any place like that's where TMJ goes. Then you want to check your maxillary and your frontal sinuses with some pressure. You can ask them, do you feel any pain? Pain with that? Okay, so on the eyes, what we want to do is we want to check, look for symmetry, the eyelashes, the eyebrows, do our visual inspection. We can start with the confrontation test, and we'll have them, I'm going to get up close to you, come out. I want you to tell me when you can see my hands.
Right there.
Okay. And then you can go superior.
Right there.
Okay.
Right there.
Alright. So once we do that, we can get our otoscope and use it as a light. We can do the light reflex test. You get about 2 foot away and you have them shine the light, and then you look for the light in the location of the pupil, which his is in the right location, so it's okay. The next thing that we want to do is our 6 cardinal positions of gaze. We start in the middle. Have them look at the finger. We're going to go to the right, here, back to the middle, over, left, up, down, middle, over. Then you go into about 5 centimeters. Good. Okay, so once that we do that, we can inspect the eye, look for any and then we can do our Perla test. Have you look straight at me. We're looking at constriction of the pupils, for them to be equal, reactive to light, and accommodations. One other way we can have you, I'm going to have you look at my finger. I'm going to have you glance off to the wall over there and then back to my finger. At this point, I'd like to verbalize the Snellen test. I'm going a normal test, you have them stand 20 foot back. You have them read the lowest number on the line that they can get, and then you encourage them to go to the next line down one time. Then you will want them to, if they can't do that with their glasses and they'll cover one eye, you have them move up until they can see it. There's a mathematical figure on how you figure the distance, whether it's 20, 30 vision, that type of thing. So that's my style test. So next we're going to go to the ears. We want to pull on the pinna and check for pain. Make sure they don't have any pain in their ears. We want to look for any drainage, lesions, redness, anything like that. I don't see that. We have no pain. You want to do an inspection with your otoscope. On children 3 years or younger, you want to pull down and back. Older than that, adults, you want to pull up and back. Place your hand against the forehead. And you want to look for the tympanic membrane. Make sure that it's white, pearly white, clear, no drainage, no inflammation. That could be the signs of infection. Then we want to do the voice whisper test. So I'm going to have you, I'm going to put my finger, I'm going to say a word, and I want you to repeat it for me, okay?
Apple. Baseball.
Okay, very good. From that point, we move on to the nose. We're going to inspect for symmetry, any lesions, any drainage, that type of stuff. We have them extend the neck up. We'll take a little bit of the point of his nose here, look for the patency, so there's no lesions, anything like that. The nose should be a little bit lighter pink than the throat, and you want to make sure the patency of each nostril and check the mucosa and the turbinates in there. So at that point, we move to the mouth and the throat. So you want to do your external inspection, make sure there's no lesions, cracks, sores, anything like that. Once you have that, you want to have them open up, stick out their tongue and say ah.
Ah.
Okay. Take your lights, you want to check the uvula, make sure it's center line. You want to grade the tonsils, the hard palate of the mouth, the teeth, the mucosa, make sure it's pink and moist. Then have them lift the tongue, lift up your tongue. Okay. And then, don a glove, you want to just feel for any masses. From that point, we want to go ahead and move to the neck. We want to inspect for the symmetry. We're going to look for the lymph nodes. We're going to start at the pre-auricular and then post, the occiput, superior cervical, jugulins, submantle, all the way down to the chin bone. Your deep chain, sometimes you need to have them turn their head to fill them. You want them to be under pea size, soft, movable, non-painful. If they're firm, swollen, won't move, it's area for further concern. Superior clavicle. Then we're going to move to the neck. We're going to check the lymph nodes, the carotid pulses in the neck, the trachea, the thyroid, muscle strength. We want to make sure that we're center and aligned, which we are. You want to check there. Okay, and then you want to check the thyroid, and we'll do that by a side right above the cricoid cartridge, right below it. You feel there. If there's any inflammation, you should probably get a stethoscope and use a small bell and listen for a groove. And that's my Heent assessment. Thank you.